Hello, my name's Peter Schneider, and today we have a special guest, Dr. Michael Lichtenberg from Arnsberg, Germany. And we're going to talk to him about a few important things. But before we start, I wanted to ask you, Michael, first of all, welcome.
Thank you.
I wanted to ask you, can you tell a little bit about yourself?
Yeah, thank you, Peter, for the invitation. Yeah, my name is Michael Lichtenberg from Arnsberg. That's the west part of Germany. I'm interventional angiologist for many years, and we are working in a center where we treat a lot of CLI patients, so patients with BTK disease, and we are running 3 labs doing a lot of BTK work, and that's why we are here today.
Very good, thank you, Michael. And of course, he's being very modest because really every interventionist who does vascular treatments probably in the world knows Michael and his center, and they've participated in so many studies. And today I wanted to ask you about one of those studies, and it's really about RECOIL. So throughout my career, I've heard that if you do a balloon angioplasty and you don't get as good a result as you want, it could be caused by certain things. Could be dissection, could be residual stenosis, and it could be RECOIL. Now, RECOIL is always mentioned, and yet it seems like there hasn't been that much literature about it. So I think this is why everyone's going to be excited to hear about the study you conducted. So first of all, maybe give us your thoughts on what RECOIL is. Why does it happen? What do you think?
Yeah, RECOIL is something indeed we learned in the recent years that RECOIL unfortunately affects our patients when we are treating BTK disease. We are aware of RECOIL from the literature standpoint for more than 10 years now. There's a very famous paper from Frank Baumann from Switzerland published in 2014 where he described and analyzed patients. He treated with standard balloon angioplasty in BTK vessels, and what he observed was an immediate RECOIL answer loss of lumen after 50 minutes in these patients. Unfortunately, it took a while actually now that we take this issue into our treatment consideration, and it's from my standpoint really affecting the patency outcome. Now, that means when we do standard balloon angioplasty with standard POBR in BTK diseased vessels, highly calcified vessels, we will have the same issue after 50 minutes before we started the intervention. And this will definitely affect the outcome of our patients with critical limb ischemia. So therefore, I think it's important to invest here a lot of brain to improve this RECOIL issue, because we all know the better the patency rate, the better is wound healing, the better is amputation prevention. So we need to talk about RECOIL.
So here we are with limb. The limb is in the balance, and 15 minutes later, what you have done is not as it's not as good as what you had hoped, and you've already lost some lumen. Now, one of the basic things I wanted to bring up or to ask your opinion on, I mean, we learn early on as we study vascular about Poiseuille's law and about how flow is related to the radius, if you would. So how do you think some of this RECOIL could affect flow in the tibials that you're treating?
You see, it's so simple. Yeah? You know, you're losing lumen which you created within minutes, meaning you're losing flow to the foot. Yeah? And this definitely will affect the clinical outcome of our patients. So our goal is to create as much lumen and as much stable lumen as we can. But with the existing technology, with standard balloon angioplasty, it seems not to be the correct method to create stable lumen. Could we prevent RECOIL with this new serration technology? This was the idea, and together with my co-PI, Dr. Vinita Chandra from Stanford University, we had the idea to set up a trial to find out if we can prevent RECOIL in comparison to standard balloon angioplasty. You're right, we do not have so much literature. We have the Baumann paper from 2014. We have a little bit more literature, but I think it's time to really prove that recoil is a problem in our daily routine. That's why we set up this trial.
So in this study of RECOIL, POBA versus Serenator, what did you find?
We find a very impressive difference between serration angioplasty and POBA in terms of recoil. And I tell you the numbers. Yeah? So we had a mean recoil across lesions in the POBA arm of 55% versus only 6% in the Serenator group. So that's highly significant difference in terms of recoil. So my personal theory is that with the serration angioplasty we increase the compliance of a vessel. And with compliance improvement, as you already mentioned, we are lowering the risk of barotrauma, dissection, restenosis and recoil. And for the immediate barotrauma problem after a balloon angioplasty, the recoil is a significant problem. And while improving compliance with a serration angioplasty.
In terms of the bigger picture, when you go back and look at the previous research where it looked like using old styles of angioplasty, almost everyone developed recoil. You could reduce it some, correct, with a better angioplasty protocol?
Yeah. So the recoil answer, if you compare, for example, the Baumann POBA group with this modern group in our study, we could definitely improve the recoil answer with a modern standard balloon angioplasty. That's true. But even with the perfect long-standing balloon angioplasty, we did not reach the level of a serration angioplasty in terms of recoil. There was a highly significant call-up adjudicated difference between these two groups.
Understood. Well, I'd like to thank Dr. Lichtenberg for his time and really like to thank him for his contributions to our field of vascular, and particularly to these extremely vulnerable patients with critical limb ischemia that we worry about so much, and for your efforts to help to develop these methods, algorithms, ideas that help to move our field forward. Thank you very much.
Thank you very much, Peter. And I would like to thank especially Dr. Vinita Chandra from Stanford. The co-PI of this trial. It was a pleasure to work with her and to get these great data out of this trial.